James Esdaile was a Scottish surgeon in the mid-1800s, working under British rule in India. He's remembered for something that sounds almost unbelievable: performing over 300 major surgical procedures using mesmerism, or what we now call hypnosis, as the only form of anesthesia. Let's look at what really happened. After receiving his medical degree in Edinburgh, Esdaile moved to India for health reasons. He eventually found himself managing a hospital near Calcutta, where he began experimenting with mesmerism on patients. It started with one case, a convict suffering from intense pain. Esdaile attempted to reduce that pain using slow hand passes, focused attention, and inducing what he described as a mesmeric trance. The patient reported little or no pain during treatment. Esdaile was intrigued. Over the next few years, he developed and refined his methods. He recruited young Indian hospital assistants, mainly men aged 14 to 30, and trained them to induce trance-like states. The process could take hours or even days, but when successful, patients would enter what Esdaile called a deep sleep that was unresponsive to pain. He claimed to perform surgeries including tumor removals, amputations, with patients showing no distress, even when no physical restraint or drugs were used. He documented his results publicly and regularly, which drew both curiosity and criticism. British newspapers in India dubbed his hospital as the House of Magic. The government, under pressure, formed an official committee to observe his work. They noted many cases where patients seemed insensible to pain, but not all observers agreed on what they saw. In some operations, patients groaned, moved, or appeared to react. Some doctors believed they were in agony. Others said these were automatic, instinctive movements, not conscious pain. One patient even cried out during surgery, then went silent, and later said he remembered nothing. This raised a complex ethical question. If a patient doesn't show pain, but also has no control or choice in their treatment, can we be sure they didn't suffer? Especially when those patients were poor, often illiterate, and under colonial rule. Esdaile insisted they volunteered, but critics argued that informed consent was unlikely. Some pointed out that patients were told the procedures were only experiments, which may have helped them stay calm, but also meant they didn't fully understand what was happening. Also, Esdaile went to India partly because mesmerism wasn't accepted in Britain. India gave him the freedom to experiment on people with very little power. Whether or not he intended harm, this raises valid concerns today. So what do we make of it now? Did mesmerism really block pain? Modern neuroscience tells us that hypnosis can change pain perception. Brain imaging studies show reduced activity in areas like the anterior cingulate cortex and somatosensory regions during hypnosis, meaning the brain processes pain signals differently. This isn't sedation, it's a shift in how the brain interprets pain. The sensation may still be there, but it feels different, or becomes irrelevant. Research also shows hypnosis can alter expectations, reduce anxiety, and increase dissociation, all of which affect the experience of pain. That aligns with some of what Esdaile claimed to observe: calm patients, altered perception, and lack of distress. So in that sense, his work hinted at something real. But here's what we must remember. In modern surgical settings, hypnosis is not used as a standalone replacement for anesthesia. That's because pain relief in hypnosis depends on many factors, including the individual's responsiveness, the depth of trance, and the context. These variables make it less predictable than pharmacological anesthesia, which must meet very strict safety and consistency standards in surgery. Still, Esdaile's legacy matters. He showed that focused mental states could change physical experience. He opened a door for future research into hypnotherapy for pain, anxiety, and psychosomatic illness. James Esdaile's story is not evidence that we can or should replace anesthesia with hypnosis, but it is a reminder of how complex pain is and how much untapped potential still exists in understanding the mind-body connection. He didn't give us final answers, but he asked questions that still matter. And for that, his story is worth telling.